Okay, in this video I'm going to walk you through the torso here that we have in our class. So I'm going to kind of start at the top and kind of work our way down. I'm going to talk about a lot of things, mainly the most important stuff that are just found on this torso or that are very easy to see in this torso. So starting at the top, obviously we've got the brain open. We've got brain models that we've seen before, so I'm not going to really focus on it. Sitting right here, kind of on the top of their left side above the eye, we can see a very visible frontal sinus. The left basically cheek and mouth have been removed. We can see a lot of different things in here. I can pull the eyeball out. The eyeball is real nice. We can see it if I put it back in. This is how it should go. Where the lacrimal gland is sitting here on the superior and lateral side, which allows you to notice the four rectus muscles: superior, inferior, medial, and lateral. Okay, and if I pull that out, at the angle here on top is the superior oblique, and then going at an angle here is the inferior oblique. Now I pulled those out so that we can kind of see some of these internal things. These little kind of depressions in here are important to identify. Those are those ethmoid air cells. We talked about the sinuses. Those are kind of a collection of sinuses, very easy to identify. Right here we have the lateral side of the right nasal cavity, so that we can see the three conchae. The superior is number 17 is pointing to, 19 is the middle, and then the own separate bone there is 21, which is the inferior nasal conchae. Right here, number 23 is the nasal vestibule. I'm not sure if that's on your list or not. That's the kind of flared portion of the inside of our nose, so we can see that pretty easily. And those open up and allow air basically all to kind of flow in to our pharynx, which is kind of in back here. We've got a couple of different things labeled in there. 24 is the opening that leads from that eustachian tube that is in our inner ear. And then 25 is just strictly the pharynx, which in this case would be the nasopharynx. But the roof of the mouth here, we can see kind of from the side here, 27 and 28 make up the bones that form the hard palate. 29 is the soft palate, and not labeled, but extending down from the soft palate is our uvula, that little kind of hanging down ball structure in the back of our throat. Here, this looks like a gland, but that is a tonsil, the palatine tonsils, as we see. Here's the very visible tongue. Sitting under the tongue is one of the very important salivary glands. That is the sublingual. Remember, the word lingual always refers to tongue, so sublingual meaning under the tongue. I'll move it here toward the lateral side of the body, or lateral side of the face here. We're looking at kind of the cheek and the side of the head. Very visible is the parotid gland and its duct, which sits between our cheek, which has been removed, and then the masseter muscle underneath. Kind of under here, under the kind of mandibular angle, is the submandibular salivary gland. So you got parotid salivary gland, submandibular, and then the sublingual we saw just a second ago. But kind of center things up here, very visible is the thyroid cartilage. That is part of the larynx. That is our Adam's apple, that kind of anterior portion there that is very visible. Sitting directly below that are the parts of the thyroid gland there, kind of forms that almost butterfly or H shape. And then below it, inferior to it anyway, is the very visible trachea. Okay, in this model we've got the sternum, the ribs all kind of in place on the outside. In between the ribs are where you can see the different two lungs. Right over here we can kind of see the cardiac notch of our lungs. And if I open up the model and pull those out, the lungs kind of come with I set those down. We know that this being the right lung, this being, this being the right lung, this being the left lung. Right there is that cardiac notch that's very visible. The other model kind of shows it a little bit better. All right, so moving down into the chest here, we have a model on the heart, so I'm not really going to focus too much on it. Take it out of the way, and that allows us to see the end of the trachea, which then forks to form the right primary or main bronchus and the left primary or main bronchus, as seen there with my fingers. For the first time, we get a view of the esophagus, which is what 184 is showing, and the aorta just to the side of it. Both pass through the diaphragm, which is what 188 is showing. Here's kind of part of the diaphragm that's sitting on top of the liver. Okay, liver is very visible. This is that dark brown part of our model here. This white line, or those two white lines, represent the falciform ligament that separates the right lobe from the left lobe. If I pull out the liver, I can examine the backside of it to illustrate the gallbladder very, very nicely. And once again, we can see the falciform ligament pretty well as it's kind of better shown up on the posterior view here. Okay, taking that out, that now allows us to see the heart, or excuse me, not the heart, the stomach, as it kind of angles here from the middle of our body toward the left side and then curves around toward the middle of our body again. Okay. Talked about the stomach. If I were to pop it open, you'd be able to see the rugae. At the top of the stomach here is that lower esophageal sphincter, or the cardiac sphincter as we like to call it. See if I can pop it open, and it might show a little bit better on the inside. And it really doesn't, but that opening is guarded by that cardiac or lower esophageal sphincter, whereas down here, this sphincter, which is what 224 is showing, would be the pyloric sphincter, which guards the distal opening of the stomach that opens up into the duodenum. Okay. Now behind the stomach, with the stomach removed, we can see three major, or really a few different major organs. The spleen visible here along the left side of the torso, the pancreas that's very visible here, the adrenal glands that are visible sitting on top of the two kidneys. Okay. With the pancreas, they've got it open to show you the different ducts. The major duct of the pancreas is the pancreatic duct, which, if you can see that little green line there, joins with the common bile duct from the liver and gallbladder and dumps into the duodenum of the small intestine. Above it is the accessory duct, which is what number 257 is showing. 262 is showing you the beginning of the small intestine, which kind of curves around back and behind the large intestine that is here. Small intestine in this model is really kind of difficult to tell what's what. You can obviously see the beginning back here, and you can kind of get a good view of where it starts to open up into the large intestine. Really, I'm not too concerned with that. You pull the small intestine out, you can kind of see it. It's all one just kind of piece. I do show you on the back side, I want to show you here, is the mesentery, which is what holds the small intestine in place. I'm going to go ahead and pull out the large intestine, kind of show you it on its own. Open here is the beginning of the large intestine, which shows you, here we can see where the small intestine would end, opening up into the small intestine, or into the large intestine from the small intestine. We have the cecum, okay, which is guarded by what we would call the ileocecal sphincter, okay, or ileocecal valve. Okay, this cecum is this segment here that's kind of a blind pouch with the appendix extending off of it. Okay, the rest of the large intestine is called the colon, You have the ascending, the transverse, the descending, and then as you can kind of see, it kind of pushes itself backwards. This is the sigmoid colon, and then the part that goes directly straight down is all part of the rectum, and really about the last inch or so is the anal canal that leads to the anus, okay, which is what that kind of orangish ring is back there in our model. Now going back over here, the large intestine, as you can kind of see, has these little pouches. Those pouches are called haustra. This white line is called Taenia coli, which is a type of, basically it's a thickened part of the muscle layer. And then holding the large intestine kind of in place is the mesocolon. That's very visible there. Okay. Now going back to our model here with everything kind of removed, going back and talking about the kidneys here, you can kind of see the right kidney a little bit better than the left kidney because the pancreas kind of covering it up. But the tubes leading from the kidneys are the ureters that run down, kind of circle around and open up into the bladder, which is what's shown down here at the bottom, right behind the pubic symphysis, which is what that number 280 is showing. Okay. That really kind of wraps up this model, so we're all good there. Thank you.